Cats, like all living beings, are susceptible to illnesses and health problems, some of which may lead to death if not treated in time. While some feline deaths are inevitable due to aging or incurable diseases, many can be prevented with timely intervention. Understanding the signs that indicate a cat is seriously ill or nearing the end of its life is crucial for providing appropriate care and ensuring they do not suffer unnecessarily. Below, we outline 10 significant symptoms that suggest a cat is in distress, may be at risk of dying, or requires urgent veterinary attention. 1. Changes in personality and behavior. Over time, cats develop distinct personalities influenced by their experiences, environment, and interactions with humans and other animals. However, if a cat exhibits a sudden and drastic change in behavior, such as becoming unusually irritable, withdrawn, depressed, or aggressive, it may be a sign of an underlying health issue. Behavioral changes can be linked to physical pain, neurological disorders, or the onset of serious diseases. If a typically affectionate cat suddenly avoids interaction, hides, or reacts aggressively without apparent reason, it is essential to consult a veterinarian to rule out any medical concerns. 2. Decline in grooming and hygiene habits. Cats are known for their meticulous grooming habits. They regularly clean themselves to maintain a healthy coat, regulate body temperature, and mark their territory. A cat that stops grooming itself may be suffering from pain, illness, or severe discomfort. Additionally, changes in litter box behavior, such as avoiding it altogether, defecating in unusual places, or struggling to urinate, could indicate a serious medical condition like urinary tract infections, kidney disease, or gastrointestinal issues. If a cat suddenly neglects its hygiene or stops using the litter box, it is a strong indicator that something is wrong, warranting immediate medical attention. 3. Abnormal vital signs. A cat's vital signs, including heart rate, breathing, blood pressure, and mucous membrane color, can provide essential clues about its health. Abnormalities in these functions, such as irregular heart rhythms, excessive fluctuations in blood pressure, labored breathing, or pale or bluish gums, may suggest a life-threatening condition. Respiratory distress, for example, could be due to heart disease, lung infections, or fluid buildup in the lungs. If any of these symptoms appear, a veterinarian should be consulted immediately, as delayed intervention could put the cat's life at risk. 4. Fluctuations in body temperature. A cat's normal body temperature ranges between 38 to 39 degrees Celsius, 100.4 to 102.2 degrees Fahrenheit. If a cat's temperature falls below this range, it could indicate hypothermia, shock, or severe illness. Conversely, a fever could suggest infection or inflammation. To check for temperature abnormalities, gently touch the cat's nose and paw pads. If they feel excessively cold or hot, it may indicate a problem. Observing for shivering, lethargy, or extreme warmth can also help determine if a cat's body temperature is abnormal. Immediate veterinary care is necessary if body temperature fluctuations persist. 5. Loss of appetite and weight. A cat that suddenly stops eating or drinking is experiencing a serious issue. While it is normal for older cats to eat less than kittens, a complete refusal to eat can result in rapid weight loss, malnutrition, and organ failure. Signs such as visible ribs, a protruding spine, or a sunken appearance indicate severe weight loss. Additionally, symptoms like vomiting, diarrhea, blood in the urine, or frequent nausea could signal life-threatening illnesses, including liver disease, kidney failure, or gastrointestinal disorders. A vet should be consulted if a cat stops eating for more than 24 hours. 6. Seeking solitude. Cats instinctively seek isolated areas when they feel unwell or are nearing death. This behavior is rooted in their evolutionary instincts to hide from predators when vulnerable. If a normally social cat suddenly isolates itself, avoids interaction, or hides in unusual places, it could indicate extreme discomfort or impending death. However, this behavior varies based on individual personality and the nature of their illness. While some cats may prefer solitude, others may become clingy and seek more attention from their owners. Recognizing behavioral changes and responding with comfort and care is essential. 7. Excessive sleeping and lack of energy. On average, cats sleep between 15 and 16 hours a day, with kittens and older cats sometimes sleeping even longer. However, if a cat begins to sleep excessively beyond its usual routine and shows no interest in play, interaction, or food, it may indicate declining health. Lethargy and extreme fatigue can be symptoms of severe infections, metabolic disorders, or organ failure. Observing changes in sleeping patterns and activity levels can help identify when a cat requires medical attention. 8. Persistent bad breath. Although a cat's breath may naturally have a mild odor due to its diet, foul-smelling breath can indicate serious health problems. Persistent bad breath may be a sign of dental disease, kidney failure, diabetes, or gastrointestinal issues. A pungent or unusually sweet odor from the mouth may indicate the presence of toxins in the bloodstream, resulting from organ dysfunction. Dental problems such as gum infections or abscesses can also contribute to unpleasant breath and should not be ignored. Regular dental checkups and veterinary visits can help prevent complications arising from oral health issues. 9. Development of lumps or tumors. Cancer affects approximately 1 in 5 cats and can manifest in various forms, including external lumps or internal tumors. While not all lumps are cancerous, any unusual swelling, growths, or masses should be examined by a veterinarian. Some tumors may be benign, while others could indicate aggressive cancers such as lymphoma, mammary tumors, or sarcomas. Early detection and treatment play a crucial role in managing cancer and improving a cat's quality of life. Conducting routine physical examinations and seeking veterinary advice if abnormalities are found is essential. 10. Uncharacteristic aggression. A normally gentle and affectionate cat that suddenly becomes aggressive may be experiencing significant pain or distress. Pain can cause disorientation, leading to confusion and defensive behavior. This aggression may be directed at owners, other pets, or even objects in their environment. Neurological disorders, infections, or severe injuries could contribute to uncharacteristic hostility. If a cat exhibits sudden aggression alongside other warning signs, seeking medical evaluation is crucial to determine the underlying cause and provide appropriate treatment. The importance of timely veterinary care. Recognizing these signs and taking timely action can make a significant difference in a cat's prognosis. While some conditions are manageable with medication and lifestyle changes, others require urgent intervention. Regular veterinary checkups, vaccinations, and preventive care can help prolong a cat's life and enhance its well-being. If any of these symptoms arise, contacting a veterinarian as soon as possible is essential. Coping with the loss of a cat. The death of a beloved pet can be an emotionally challenging experience. Many people struggle to process the loss, as pets become cherished members of the family. Grieving for a pet is natural, and seeking support from friends, family, or pet loss counselors can help navigate this difficult time. Creating a memorial, sharing stories, or keeping a keepsake can provide comfort and a way to honor the cat's memory. If you have experienced the loss of a cat or have stories to share, feel free to express them in the comments. Supporting each other through shared experiences can help provide solace to those going through similar situations. For more information on feline health, diseases, and care, explore our resources and videos dedicated to helping pet owners keep their furry companions happy and healthy.